Good evening, dear friends. So, as I promised you, I always keep my promises. I gave my word and I kept it. The deep muscles of the back. There are all sorts of clueless people who love to talk about them, even though they don't really understand muscles. And so, instead of memorizing all the numerous muscles that are in the back, they say you need to train specifically the deep muscles of the back. So, the person who tells you that you need to train the deep muscles of the back, you should first ask them, which muscles do they actually mean? For example, the highly respected Shoshone, he means the intertransverse muscles. He considers those to be the deep muscles. There are also other clueless people. Some of them call themselves doctors, some don't. They also mean some kind of muscles. For example, here they are, this whole deep muscle group. I'll show you later. Basically, these are the small, thin muscles that are located between two neighboring vertebrae. Or for example, from one to another, skipping one, they go like this. There are a lot of them, and they are considered very important. They are not bothered by the fact that there are also huge muscles here, like the back extensors, the latissimus dorsi, and the trapezius. They say that these muscles can be well developed, but it's these small, deep muscles that cause all the problems. Let's take a look at these deep muscles first. Come over here. Come closer. Look carefully. There's a special interactive program here. See? We add layers, and the muscles appear. Here are the deep muscles. These are small, thin muscles. They're also here, and then there's the next layer, a bit thicker, but still not particularly strong. But this is already helping her. Here are the intermembranous, intertransverse muscles named after Dr. Shonin. Here they are. Here, he thinks that all the problems are because of them. Because of this tiny little thing, this one, that's all. Now, if we take any Shoshonen on the street, catch him, take this muscle with scissors, snip, cut it like that, he won't feel anything, really won't feel anything. Just like before, Shonen will remain Shoshonen, just the same. He'll feel perfectly fine. Maybe, maybe not. Now, look further. Here it is. These are the smallest, the thinnest muscles, the ones everyone loves to train, and because of them, they have all their problems. Their training methods are simultaneously unclear and clear. I'll tell you how they train them. They think they're actually training them. These are already more significant muscles. They already play a role, and these ones play an even bigger role. Because, after all, the more powerful the muscle, the bigger it is, I think, the more influence it has. Which do you think? Which muscles are stronger, more important? These huge ones or these small, useless ones, you see, they appeared in the vessels, these little ones. If you cut off any of these muscles, you won't even feel anything. Even at night, when you're sleeping, someone could sneak up to you and quietly snip, snip, snip all these muscles with scissors, and in the morning, you'll wake up. You'll feel perfectly fine. Nothing will happen to you. These muscles, they don't play a significant role, neither in movement nor in stabilization. It's just a layer of muscle, the deepest one, but probably you could say the deeper, more powerful, larger muscles are more important than these small muscles. They, well, you could say participate, maybe for more precise, maybe. What kind of movements for stabilizing movements do not play a significant role, the smaller the muscle? Well, if it's a muscle group like on the back, yes, and it makes a general movement. There are small muscles, for example, right next to them. There are no big ones. That's when they matter. But here it's all these layers and even worse. Yes, these ones here. The short neck extensors also belong to the deep muscle layer. Here, look. The short neck extensors, this is also the deep muscle layer. Here they are. This whole group, these are the short neck extensors, and above them are the more powerful ones. Here are the long neck extensors. There are also different groups of muscles here. The muscles lift the scapula. And on top is the trapezius. This whole area is covered by the upper part. Here is the short neck extensor. There are often a lot of problems with them, because when the long neck extensor, these powerful muscles, the long extensor, the neck, the trapezius, becomes weaker, the short muscles start to get overloaded. The load goes to them, and because of this, they start to increase in volume, and the vertebral artery passes between them. Okay, once again, just to make it clear, here it is, here they are. These are the short neck extensors, and right here is the vertebral artery. You see, there are different vertebral arteries here. Here it is, right here between the transverse processes, not exactly between, but in the canal. It goes right through, and here it enters, here it is positioned, and here it passes right next to the short neck extensors. They carry it, regarding what is it. So when this muscle becomes hypertrophied, not only can it go into spasm or remain in spasm, but it can also increase in volume. And if it becomes larger than it should be, it starts to compress the blood vessels. It starts to squeeze the artery and veins a little. The artery just a little, but the veins can be compressed quite strongly. And in this case, all the problems will start because you have trained these deep muscles. The same thing can happen with these muscles. But, thank God, you will never be able to train them in isolation, no matter how much you want to. Maybe, and I've seen different exercises for deep muscles. One of them is an exercise on an unstable support. This is what Vasilieva liked to show when she was young, when she could stand on an unstable support. Or maybe she didn't show it herself, I don't remember exactly. So there was a log, like a stump that was split in half, and you had to balance on it. And this balance, as she believed, by the way, she was also really into deep extensors for a while, until she got a better education later on. And she also thought that when you stand like this, balancing, those short, deep muscles, the extensors of your back, develop as well. There were even some special ones there, those wooden sandals, and you also had to somehow stand on them. Now, I think they don't do that anymore. They used to do those things before, but now it's gone, I guess. Or maybe they still do, I don't know. In short, there's no real benefit from these deep extensors, but there are some exercises, like some really strange ones, even hard to understand. But basically, there's no point because these exercises always end up training the bigger muscles. So, for example, let's say we want to improve our neck. We train the neck extensors. We train the trapezius, the sternocleidomastoid muscle. We train it. If we want to improve, let's say, the thoracic part of the spine, what do? We train the muscles between the shoulder blades, the middle trapezius, the upper trapezius as well, the lower trapezius. We train the rhomboid muscles. We train the latissimus dorsi. We can stretch the pectoralis minor, and we also train the chest muscles. Usually it's the clavicular portion, this weak chest muscle. More or less, the lower back is working here. We train the quadratus lumborum, the lower back muscles. Often there's a difference. Sometimes the right or left side is trained. Very often one side is shortened. There can be shortening. We pull in the stomach. We train the rectus abdominis, the obliques, and there's a difference between the right and left sides. Then we also train the glutes with the piriformis muscle to relieve the load, the gluteus maximus. We train the gluteus medius. We train the lumbar muscle. Sometimes you need to stretch, sometimes you need to train. The posterior thigh also affects the condition of the pelvis, sacroiliac joint, and lower back. Also, very often, the posterior surface of the thigh is weak. The thigh itself is also very often weak, the rectus femoris, and the legs are most often weak as well. It just happens that a weak muscle can be overloaded, and at the same time tense. Sometimes, well, what does it mean? Short extensors, right? Well, of course, now let's do an exercise for the deep back muscles. Finally, I'll show you exercises for the deep back muscles, the deep muscles of the spine. Thank God they don't exist separately. It's impossible to train them in isolation. Training always involves all the muscles at the same time, meaning all the muscle layers will be trained together. If we take the back extensors separately, we can train it and put more load on the trapezius and different parts. we can put more load on the latissimus dorsi muscles. Well, let me show you an exercise not for the deep back muscles, but another useful exercise that goes well with stretching the chest muscles. So, in cases when the shoulder shifts forward like this, it's actually good to start training the trapezius, the upper trapezius muscle. It's often tense, and people keep trying to relax it, but unsuccessfully. It just gets tense again and starts hurting all over again. If you look, headaches can also be caused by when a person moves their arms. The shoulder lifts up due to the deltoid muscle's involvement and the trapezius muscle's weakness. Let me show you then what I haven't shown yet. In general, I don't know how deep this muscle is, or how much those who like deep muscles will appreciate it, but you can train the trapezius like this. In general, it's easiest to learn this movement with a roller. You take a roller like this, place it back here, hold it lightly with your hands, and here are your elbows. You need them not to point to the sides, but a little bit back, as much as you can manage. And in this position, you start to roll this thing up like this, right along the wall. And here, you shouldn't look forward. If you look forward, this exercise is harder to do because at the same time as the movement, the muscles that lift the shoulder blade will be engaged. So, in order to put the load specifically on the upper trapezius, in this case, you need to look down. You look down, you lift, with your hands, take the roller, pull it up here, and now your trapezius is engaged. So, are you trying to bring your shoulder blades together? Right at this point, right here, in the upper part of the thoracic spine, almost where the sixth ends and starts, where those protruding vertebrae are. By the way, this exercise will also help those who have a little hump right here. It's quite interesting, and it will be pretty good for you too. So you place it and do this movement, stretch once and back. That is, your task is specifically not to lift. You are trying to bring your shoulder blades together. Everyone knows how to do it like this. And in this position, you also need to bring them together. But they will come together a little differently than if you were doing it another way. But in this position, it will work more. It's exactly this part of the trapezius muscle that is constantly getting weaker and constantly hurting. In this exercise, the most important thing is to look down here. If you did it correctly, you will feel tension right in this part of the upper thoracic area, right where the upper trapezius is. Not here, not here. It will tense up for you a little bit in the back. If you did this exercise incorrectly, for example, if your elbows are a bit to the side or you didn't lower your head, then your head might start to hurt in the temples. Right here, because you will overload this, the upper bundle of the trapezius. It will also get some training, but not the whole muscle will be working. I need this part, and when this part of the trapezius hurts, it gives pain right here, such a referred pain in the temples. So if you do everything correctly like this, you will feel how it tenses up. If you've never done this exercise in your life, it will hurt a little. That's the place where your trapezius should be, but it's not there yet. Then it will grow, God willing. That's how it is. So we'll leave the deep muscles to those who don't really understand all this, and we'll pay more attention ourselves. In short, the smaller the muscle, the less important it is. If this is some kind of muscle complex, there are muscles you can't live without. Small ones. But right here, these are the deep muscles of the spine. This in general. It's such a thing, you know?